All right, welcome back to Heard It Here. I'm Kaylee Mason, your host and beef advocate. We've got a really special guest today, Dr. Gina. She is an instructor and the veterinarian here at Triple C. She's here to help us break down the importance of pre-breeding shots in our cattle and the difference between the shots that we give heifers versus cows. Heifers go through a breeding soundness exam at pre-breeding time, and at this time we're giving heifers bangs vaccinations, pre-breeding shots, and measuring their pelvis. But before we get to that, Dr. Gina, do you want to go ahead and tell us and our listeners a little bit about yourself?
Yeah, sure. Thank you for having me. I am a huge podcast medium fan, so appreciate being on. As you said, I'm Dr. Gina. Van Lunen is my last name, but most of the students just call me Dr. Gina, Dr. V, any of those things work. I'm a 2018 grad of Kansas State University College of Veterinary Medicine, and I spent the last 5 years in mixed animal practice before I took the job here at Triple C, as you called it. I like that. So I've been here since 2023, and I am the attending veterinarian in the sense that I do the work of the animals that we house for veterinary nursing, so spays and neuters on the dogs and cats that we have in there. But then I also am an instructor, so teach in the veterinary nursing department and then help out the beef and equine units whenever I can do so. So if they have emergencies or need help with anything, I do the best I can to help with those too, because I like those species.
Awesome.
Yeah.
Well, thank you for taking the time to come and talk to us today.
Absolutely.
We are going to go ahead and get started talking about bangs vaccinations. So what is it and why is it important for heifers to get this vaccination?
Yeah, so bangs is the layman's term that we're using for Brucella abortus, which is a very highly contagious bacteria that animals can get. It is zoonotic, so that is a big concern that we'll get into a little bit later. But basically, it can cause abortions. So it can cause a spontaneous pregnancy loss, which in veterinary medicine, we describe that as an abortion, but humans would call that a miscarriage. So interchangeable words that we can use there. But they're the same thing. And we give this vaccine as part of pre-breeding in our heifers from 4 to 12 months, just to give them the best chance of not contracting the disease.
So if a heifer does not get this vaccination, what could happen?
Yeah, so I just briefly touched on they can abort or spontaneously lose a pregnancy, but there's a number of other reproductive diseases that they can get. So I have here weak calves, low milk production, retained placentas, ultimately things that are going to cost the producer money in the long run. So we'll talk about, the business of the cattle industry that we're trying to eliminate that or make that as low as possible for the producer. So it can cause just a number of disease or reproductive diseases in general for cows.
Kind of a big deal.
It is.
So continuing with more vaccinations, when we talk about the pre-breeding shots, can you tell us what producers would typically vaccinate females with, the disease that it's targeting, and the importance of those vaccinations?
Yeah, absolutely. So when it comes to our cattle vaccines, you can think of them in a couple different categories. I think the general categories that I like to think about are the clostridial diseases. Most producers are going to refer to those as your black leg products. And then you'll have the respiratory diseases, and those are going to be contained in a different vaccine product. So for pre-breeding, we add a vaccine that targets reproductive diseases, and most of the pharmaceutical companies have been able to add this pregnancy protection into the respiratory disease, basically the respiratory vaccine, so you're not giving so many shots at once. So while you're boostering the respiratory component that calf had at basically branding time, you're also now adding the reproductive component, which is going to be protective against diseases like leptospirosis, infectious bovine rhinotracheitis or IBR, and then bovine viral diarrhea virus or BVD, BVDV, whatever you may hear it be called as. So for instance, basically 60 days prior to breeding, our naive heifers are the ones that have not been exposed to any sort of reproductive products before. We're going to vaccinate them with the reproductive diseases in addition to their bangs vaccine. Then we'll come back and we'll booster that pre-breeding shot in about 30 days. Bangs does not need to get boosted. Of course, you're going to check all the labels and decide with your veterinarian how you're giving these vaccines, but that's kind of the general component. So 60 days prior to breeding, expose them to the pre-breeding shot, and then 30 days later, booster it. I think also because we don't have any affiliation with any pharmaceutical companies, I think it is helpful for producers to sometimes just hear what products that we're talking about. So I just took 3 pharmaceutical companies, Elanco, Zoetis, and BI, or Boehringer Ingelheim, and I just wanted to kind of describe what products they have that are specific for these pre-breeding vaccines. So for Elanco, MasterGuard 10 HB and ViraShield 6 plus VL5, really common ones that producers use. For Zoetis, Cattle Master Gold FP plus L5, and then BovaShield Gold FP VL5. And then BI has an express line that has FP and 10 HB. So basically, the FP is fetal protection. That's what it stands for. So when you see that on a package, it's usually a pre-breeding vaccine. This by no means is an extensive list. It's just a couple of different products that I was just looking at this morning that producers may recognize that they've seen. They might find in their farm that they like sticking to certain brands. They might find that their veterinarian only carries certain brands. So it's really not a big deal to stay with a certain pharmaceutical company. It's more a big deal to understand what type of vaccine you're giving. So we'll talk a little bit later about the differences with modified lives and with killed, and that will start to make more sense. But those are just a couple of the products that producers may have heard over the years that they've given.
And if they decide to, that they want to switch, can they?
Yeah.
Like, there's no
Yeah.
problem switching between like pharmaceuticals.
No. So I think that's another just like misconception that producers have, that they have to stick with something. But no, they don't have to stick with anything. And again, we'll talk about when it would be ideal that they stay with certain product lines and how the vaccine is basically written. But they can do different things for the cows versus the heifers. It just kind of depends on the vaccine protocol. But this is just another like great point that veterinarians are always trying to make, like to have a good relationship with a veterinarian, because you can get those questions answered. Like that's our job to kind of, give you that recommendation and give you that confidence that you can change product lines or whatever it may be. But that's why we have nice relationships with vets. For sure.
Okay. Do you believe that pre-breeding shots should be given yearly to all breeding cattle in an operation, and why?
Yes. Yeah, absolutely. So anytime we're talking about vaccines, every single time that we booster a vaccine, we're encouraging that body to respond by gaining immunity, right? And we're trying to eliminate as much disease as possible. So vaccines are incredibly important to all species, but especially when you're raising groups of animals. This is not just your dog that's only exposed to you and your family, but it's 100 of your cows or 500 of your head, whatever it is. They have nose-to-nose contact every day. They can't really eliminate their incidence of exposure, so they're always going to be exposed to other animals. So super important in this group raising setting that we are boostering vaccines all the time. And then you're going to introduce a new cow or a new heifer to the farm, and she's going to be exposed to way different things than your animal has been exposed to. So you're never really getting away from disease in general. And they also live outside, so we can't get rid of our bacteria or our viruses outside. So definitely important to continue to vaccinate, and that helps with protection.
Do pre-breeding shots improve conception rates? What if they're not administered?
Yeah, absolutely. So at the end of the day, the cattle business is a business, right? So there's a monetary value that we have with every open animal. Our goal is basically to make the operation run as efficiently as possible. And so that includes vaccinating to increase things like conception rate. And then on the back end, the producer is hopefully going to get more money associated with that. So as a clinical veterinarian, I'm definitely not the person in charge of any like current research on what's going on with the vaccines right now that are being produced, but that's what our land grant universities are for. So there, might be at this moment in time of vaccine trial that's going on at somewhere like K-State where they're looking at the difference between naive animals that have never been vaccinated and then animals that have full protection. And so what are the differences of conception rates? So the goal is to make this the best situation for our producers because this is their livelihood. Agriculture is their livelihood. It's what they do every single day, and we want as much income for them, and that has a lot to do with getting calves on the ground. So absolutely.
Mm-hmm. So are vets only allowed to give pre-breeding shots just like the Bangs vax?
Yeah, so this one is just a unique situation. Our brucellosis or our Bangs vaccine does need to be given by a licensed veterinarian. And I think that it just has a lot to do with the zoonotic nature. So we don't want to be stabbing ourselves with it because it will cause miscarriages in women, and a lot of our veterinarians nowadays are women, especially with large animal. We definitely have lots of women that are the ones giving this vaccine all the time. And then because this is a reportable disease. And so a reportable disease means that the Department of Agriculture in the state of Kansas wants to be aware of when there is positive brucellosis cases, just to track it. And that has a lot to do with the fact that it is so contagious. So being that, again, agriculture, meat industry, we can kind of wipe out a number of animals very, very quickly if they were to get sick because of how contagious it is. So we don't want it to become endemic or become a pandemic or any of those things. So this one is unique that a veterinarian has to be giving the vaccine, or it needs to be given under the supervision of a vaccine. So, for instance, I'm having a second baby, so I did not give this one this year, but I had one of my nursing students give it right in front of me. So that sort of thing. Mm-hmm. The rest of the pre-breeding shots do not need to be administered by a veterinarian.
Okay.
So just the Bangs.
Have we seen any Bangs outbreaks recently that you know of?
Not that I know of. With the students, I kind of do talk to them about how we give this one basically in the state of Kansas between 4 and 12 months, and then we don't repeat it at all with maturity, just based on the information for our area. But in places like Montana and some of the national parks up there, it is endemic. So elk and deer also get it. Mm-hmm. So they do vaccinate their cows. So that's a much different situation. So we're not in that situation right now, but you never know.
Oh my gosh.
Yeah.
Well, I hope to not know.
Yes, yeah, me too.
Well, it sounds like vaccinations play a really big role in reproduction. You had kind of touched on it a little bit earlier, but would you mind explaining the difference between the modified live vaccines, killed vaccine, and why we have to be careful giving a modified live to pregnant females?
Yeah, so I think in the most simply put terms, modified live vaccines are a live virus that just has basically it's in a weakened manner, and we give that as the active ingredient. We're killed, the virus or the bacteria, whatever we're targeting, is killed in the vaccine. So we're giving strains that are just a weakened version with the modified live, or totally killed if we're using a killed product. So the research shows that the modified live conveys way better immunity against whatever disease we're targeting. Therefore, we're trying to put those in our vaccine protocols. That being said, there are times where we cannot use a modified live. So again, you're going to be reading the claims with the veterinarian you're working with, reading the label on the vaccine because that's going to give you the most up-to-date information. Some products, for instance, though, basically say that it is not safe to give the modified live when a cow is bred unless she has been exposed to that product when she was open. So another great reason to give our pre-breeding vaccines, because that would be a time where they are open. If we give them a modified live product, we can go ahead and follow that up with a modified live when we are at the time of preg check in the future. Because if you think about it, the other times of a cow's life, she's going to be bred most times of the year. So when we go to vaccinate her annually, the most practical time is just at the time of preg check. So she is more than likely going to be bred. So we want a safe product to give her during that time of preg check. So just a couple other things with that. Like when I was looking up label claims this morning, kind of preparing for this, Cattle Master Gold FP5 does claim to be safe for pregnant cows. So that one has basically a label indication that you can give it no matter what. Whereas Express FP basically says this vaccine may be used in pregnant cows or calves nursing pregnant cows, provided that the cows are vaccinated pre-breeding, according to the label instructions, with any Express FP vaccine in the last 12 months. So this is, again, another reason just to have a relationship with a veterinarian. It's our job to basically sift through all this label information and then give you the best recommendation for your herd. It's a very individualized protocol. We're not just doing the same kind of cookie cutter thing for each farm. So it just depends on what that farm needs, and that's the job of your veterinarian. And I think I also just want to remind students all the time that another simple way to think about it with modified live versus killed, if you have to mix the product, it is mostly modified live. So more than likely modified live. So if you have to take a diluent, some sort of sterile component, and add it into powder, those are going to be your modified live products, whereas killed just sit in the fridge and are already pre-mixed, basically. Mm-hmm. So that's another way to think about it, just in the practicality sense of what you're grabbing. So yeah, you'll work on all those protocols with a veterinarian to decide what makes the most sense.
All right, so moving on from vaccines and the shots, let's get into the pelvic measuring. Yeah. Would you explain that and kind of the role that it has in breeding and calving management?
Yeah, so if you've never been around it, it would be quite alarming to see it for the first time. The CCC here, we've worked together to get me a little GoPro, so sometimes I'll be rocking the GoPro and it just sits kind of here on my neck. And the first time I used it, I was doing pelvic measuring, so I thought that was a really fun and interesting time. But we're going in rectally. We're taking a tool and we're measuring the height and the width of that heifer's pelvis, and then we are there's basically an algorithm to multiply those two numbers together and get basically a value that there's research to indicate basically cutoffs for that heifer. So at this centimeters, we would recommend getting rid of her in the herd as a breeding heifer or sending her to the feedlot. She would do better in that sense. But basically there's numbers to predict the size of the pelvis, and then you can even predict the size of calf that she can handle. And if you are, really selective with your bulls, you can look at EPDs and choose on the bull side, if he makes a 90-pound calf every single time, it's probably not going to be a heifer safe bull if your heifer can only manage a 70-pound calf. So again, I'm just using, arbitrary numbers that don't mean anything, but that is what the pelvic measuring, that's what its intention is to do, is to give us those values so that we can send really immature pelvises, to the feedlot or cull them from our replacement heifer crew, or we can keep our mature ones and choose different bulls based on their level of maturity and tone of their uterus. While we are doing the pelvic measuring, a lot of times we're also giving a reproductive tract score. So we are feeling the ovaries, feeling if there's follicles on those ovaries, feeling the tone of the uterus, and deciding in a grading scale, basically, what we believe the maturity level of that specific heifer is. So again, very specific to each heifer. So the idea behind all the pelvic measuring is, again, profit focus. We want to eliminate any obstetrical complications. So that's going to look like cesarean sections that the veterinarian has to perform a surgery in order to get that calf out of the flank, or pulls, so obstetrical pulls when you're, sticking chains on that calf and having, less than ideal calving scenarios. All of that costs money, or it costs time, which in theory is money for the producer. So the goal behind something like pelvic measuring is still like a very profit-centered idea process for the best situation for the producer.
Mm-hmm. And I just remembered my question.
Oh, yeah.
So with the pelvic measuring and all these pre-breeding shots, if you have a heifer in your herd that you're deciding to cull and you're looking for replacements, would you also then do all of the same exam for your replacement? Or should that have all been done like before, whenever you're buying your replacements? Like, when is that in the timeline whenever you're choosing a replacement heifer?
Yeah, so I would say the experience that I see people do the most is they're doing it on their own heifers, that they're deciding whether or not they're going to breed them and keep them in the herd, or if they're going to go to a feedlot scenario or just get culled. That being said, on the backside, I guess you would want to know, if you're buying a heifer, if she ever was pelvic measured. That would be great information and great insight. I don't know in my own, I guess, experience if that leads to more dollars when you're buying a heifer that has been pelvic measured. That would be a good thought, though.
Mm-hmm.
So yeah, I don't really know.
Okay. Well, yeah, because if I'm buying a replacement, I would expect her to be able to carry the kind of calf that I'm needing for my. If I had a bull, or I knew what kind of.
Yeah, I don't know if people do that really practically. Like, again, like our situation at the farm, we're just taking all the heifers and deciding who makes most sense for breeding,
Mm-hmm.
and then kind of culling out based on the pelvic measuring. But I don't know if anyone buys anything that, like, I think people mostly buy heifers bred if they are buying heifers.
Mm-hmm.
So, but that's like
Okay.
always scary for people when
Yeah.
they buy heifers that are bred, because they don't know what they're getting.
Mm-hmm.
So and those are the ones that you're going to be up every couple hours with, trying to see how they're going to do, because it's just like us being first time moms, like, it's just the body doesn't always know what to do that first time. So
Mm-hmm.
they're the risky ones.
Yeah. Okay, so then kind of leading off of that, do you see a lot of producers utilizing the pelvic measuring? And if they're not, would you recommend it?
Yeah, so I would definitely recommend it. That being said, I think we live in a very progressive cattle area. So I think Northwest Kansas can be very progressive, that we take the recommendations from our veterinarians. Our producers seem to take recommendations from veterinarians. And so I think a lot of guys are doing it around here, or females for that, any producers. Mm-hmm. I think they're absolutely utilizing pelvic measuring and getting good information on the backside, that we're not having to do as many C-sections each, spring. So that is great for veterinarians too, because C-sections don't come between 8 and 5. They come at very different times.
Mm-hmm.
So when it comes to our students, obviously these are going to be you guys are going to be the next generation of cattle producers. So I do think it is really great that Adelaide and I are both, young professionals in this program and giving these recommendations, because a lot of you will take this back to the farm that you're going to, or when you have your own animals, you'll decide to pelvic measure because at CCC you pelvic measured, and that gave you good information and good insight. But it's all about just exposing students to basically the latest and greatest data that we have, and then them deciding on their own if they want to implement that. But I do think that it is something good that we're teaching and kind of trying to pass down to the next generation of cattle producers.
Mm-hmm. Absolutely.
For sure. So yeah, just in summary from the whole topic that we were talking about 60 days out from breeding, we're going to vaccinate our heifers with a respiratory vaccine that has some version of fetal protection in it. So that's the pre-breeding shot. We're going to give a bangs vaccine and pelvic measure ideally. You might also do deworming at that time. You might do some sort of, external parasite control, any of those things. But that's what we do 60 days out from breeding. 30 days out from breeding, we're going to go ahead and booster that respiratory plus fetal protection. And again, majority of the time we're using some sort of modified live product, but we could also be using killed depending on the scenario, or if we have one left in the batch and we don't want to mix up another modified live, whatever it may be. But there's a number of products out there on the market, and those would be protocols that you would figure out with your veterinarian on what makes most sense for your herd.
All right. Well, thank you so much for all of this valuable information. I even learned some just sitting here, and as a sophomore, I've had 2 school years now of learning this, and doing it is very different than the textbook or just the hearing about it. And so I would encourage any listeners that have any questions to reach out to Dr. Gina or even Adelaide Klein, our beef program director. All of their information is on the CCC website. And
don't feel intimidated. This is we keep saying this is a very meaty subject matter. I guess no pun intended with that, but it is complicated, and that is, why we go to school for it. And so students have to hear it multiple times. So don't feel intimidated by it. It's still hard for me to explain sometimes too. So
yes,
it totally makes sense that it is tough. You're thinking about all the questions on your exams and your finals,
yep,
and maybe how we could have improved some of those answers, but it is a meaty topic. So don't worry about that.
Well, thank you for spending the time to try to, not dumb it down, but
simplify it to some
for us.
extent. Yes. Simplify.
So, really, congrats.
Thank you
on your pregnancy.
Yes.
We will not be seeing her for how long will you be gone?
Oh, I think I'll be around.
I hope so.
Yeah. So I think I'll be in and out around doing some surgery. I might have a newborn strapped to me, but I'll be around. So don't worry.
Perfect.
But yeah, I will be having a second baby with the cows in, early spring. So
awesome. All right. Well, that is all for this gathering.